when you facilitate, you try to get something to contract or something to do something, right? The opposite of that, we've got to try to get you to relax, inhibit. So the root words would be to promote versus relax, or facilitate versus inhibit. So if I don't want the muscles to tighten up, I avoid some of the things we were showing you. You don't do quick stretches. You don't do tapping. Therefore you don't do quick motions, because that sort of promotes a muscle to tighten. Fast things, tightening. Slow, relaxed things, relaxation. And this is a relaxation thing. So I'm trying to inhibit muscle tightening. So this is somebody who has like spastic diplegia, tightness in the muscles and the legs, for a host of neurological possible sources. So what you would do is I would just grab the legs like this, and I just do a little bit of a rotation here, nice and slow. So I'm taking the hips here, kind of internally rotating them here, and just pulling them apart, and the next one rotating the hips. And what it is as I go here, I try to pull a little farther apart each time. You'll get folks with spastic diplegia where their legs will scissor. We can see the hygiene issues with that. So we got to get these legs apart. Obturator nerve injuries where the nerve to the adductors isn't working, so therefore the muscles are tightening up and doing a spasm across. I've seen patients who were so bad they had to go cut those nerves to those muscles, so the nerve muscles basically die, and it quits and the scissoring effect. So it's basically the speed. So don't do that to your patients. Right here like this, and this time we'll just relax. And this would be in a patient. This would be real hard right here. I will be pulling, and I don't try not to go back to the start every time. Real slow. Try to abduct those legs. So this would be a nice relaxation for the legs. A little bit of distraction, where we talked about that relaxes the muscles around the joint, but mostly it's just arcing. There's your rotation component, because you're going in an arc, which is part of a circle, and then I'm adding a rotation of the hips right here. See how those are rotating? That's the component I'm adding when I get to here. See, she's nice and relaxed there. So that's for the lower extremity. Upper extremity, grab neutrally, so I'm not slobbering anywhere. And I'm just going to, again, arc-like motion, smooth, slow, back and forth. So for anybody I was stretching in the arm, frozen shoulder, spasticity, this would work. This isn't PNF thing, but this kind of a test that I know to relax. If I can do like that, I know that shoulder's relaxed and do what I want to with it. And I would do the other stuff, my lobes and things. That's the rhythmic rotation. Best. You can also do it with the whole body, rock the whole body, but we'll do that when we put the mats down. Then you've got hold, relax, contract, relax. We did that last semester, remember? Put the towel around this knee, get this leg up here like this, on your shoulder, put your knee up here on this, have them push down. We showed you for the hamstrings. That's how we do the hamstring. So she'd push, quit, push. If she pushes down, I tell her to relax. When she relaxes, I would take up the slack. That will work for any muscle group. I could do maybe hip flexors and quads are tight, so we're having roll on our stomach, roll for me. And you could put this, say this leg goes up and it's that far away. I can get in here behind it and tell her to try to straighten her leg out. Go ahead, push, 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 and relax. And I stretch it in. Take up the slack. That would really stretch everything in right here. And the other one I use it a lot on is roll back over into your back for me. The frozen shoulder, folks, is so they can get the bit right here, and that's it. Then what I do, get position, I have them try to internally rotate, because the internal rotators are tight, and then I stretch them out. So go ahead and pull in, pull, 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 relax slow. I take them the rest of the way. Take up the slack. Now we'll do it again. Go ahead, pull, 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 relax, and take up the slack. Only take up available range. We don't have to worry about hurting anybody. Just take what's there. Now you're getting a little more because you're having them contract first, which really forces that muscle will tighten up and therefore relax. You get maximum relaxation after maximum contraction. So that really facilitates the stretch. And last semester rather, we showed you how to do it on the hamstrings, but any muscle group. And I thought it worked well on the hip flexors and the shoulder rotators. I've used it on those quite a bit with good success. Questions on the hold relax and the rotation? Let's try those.